Who are you? What's your, really what's your superpower, and why should you win this award?
Constant Therapy provides digital speech and cognitive therapy to patients at home. This enables patients to be getting continuous therapy, which is typically about 5 times more therapy than they would otherwise get. These are stroke, dementia, brain injury type of patients that also leads to continuous monitoring of their cognitive health. And our superpower is really that we're enabling not only patients to get that at home, but enables clinicians to monitor the patients, really practice at their top of their license, and reduce clinician burnout as they deliver care to patients at home. And to date, we have delivered over 275 million exercises to patients, most of them at home. And we have partnered with some of the large home health providers, delivering our solution to enable these types of patients to really get on their journey of independence and recovery.
We want to know, like, what is going to be what's the big change? What's the big impact your company is going to make on patients in this space? If you are, I mean, I know most of you are successful already in different ways, but again, like, what is going to be the biggest long-term impact that you're going to look back and go, we did that?
Yeah, so and I think many of us here would agree that the brain is probably the most important organ of our body, and our impact is really around enabling that cognitive health for patients. And as we know, with the aging population, this becomes a bigger and bigger issue. So we are really truly enabling patients to gain independence, whether it's a dementia patient, the millions of dementia patients, or stroke patients or brain injury patients, to be able to get the necessary intervention and monitoring to enable them to either improve, if they are able to improve, or maintain cognitive function so they can be more independent at home for longer. That's really significant in terms of both from a cost standpoint, as we look at the cost of healthcare for that population over time, as well as in terms of the quality of life that quite honestly, patients, these patients deserve and need.
What's your data and how it's impacting and directly impacting patient care and outcome?
There's several clinical studies that have shown improvement in patient outcomes on standardized tests like MoCA and other cognitive tests for stroke and dementia patients using constant therapy. So in addition to that, what we have seen is the program is already being used by patients at home. We have served over 700,000 patients now through our platform, over 275 million exercises done. And specifically in terms of cost impact, if you look at dementia patients, one of the studies at the VA has shown that promising results for patients being independent for 6 months longer using the program compared to what they would have otherwise seen for these patients. So that translates to about $24,000, $12,000 in cost savings in terms of the cost of care for these types of patients. Recently, one of our home health provider partners showed that they're able to save about 15 to 20 minutes per patient session in terms of the provider's time. That is significant because it saves about 1 hour literally per day for a clinician in the home health scenario in terms of providing care. That leads to more patients being seen, less clinical burnout, et cetera. So significant cost impact both from a provider standpoint as well as from a payer or patient's quality standpoint.